Today we'll be seeing skeletal system. So skeletal system includes bones and cartilages. It forms main supporting framework of body. So it is going to be a structural framework for the body. It includes bones and cartilages. So in this figure you can see some bones, and there are other structures called cartilages. We will see what are cartilages very soon. The function is it helps to move the movements by attached muscles. So the muscles which are attached to the skeletal system that helps for the movement of the body. Now, what are the composition of bone? How a bone is made of? What is the structure that a bone has? It has got two parts: organic part and an inorganic part. Organic part constitutes 1/3 of the weight of the bone, whereas inorganic part constitute 2/3 of weight of bone. Now, what is inside an organic matter? Inside the organic matter, we have fibrous materials and cells. So there are living cells which are seen in the bone, and some fibrous material can also be seen. So this is responsible for toughness and resilience. So this is important for the toughness of the bone, because the bone is a tough structure. Now, coming to inorganic matter, they are minerals which has calcium carbonate, calcium fluoride, magnesium phosphate. These are the main minerals which are seen in inorganic matter, and this is responsible for rigidity and hardness. So it also helps in rigidity. Now, the presence of calcium in the bone will give you a feature that is a radio opacity. The bones are radio opaque. When the X-rays are passed through the bone, since it has a lot of calcium, it does not allow the X-rays to pass through. That is the reason it can be seen in the X-ray film. This is an X-ray of hand where we can see the carpal bones and some metacarpus phalanges. So this is a property which is called radio opacity. So radio opacity is because it has got calcium. Now on the right hand side, a bone structure is shown. A section, a horizontal section and a longitudinal section is taken, and this is how a bone looks in a microscopic. So the bones are placed here, the cells can be seen, the cells of the bones can be seen, the blood vessels can be seen which are reaching the bone. You can see the particular arrangement of the bone. A circular arrangement can be seen here, and the osteocytes or the bone cells can be seen in between. So we will see these things microscopy in the coming slide. So basically you should know that we have organic matter and inorganic matter. Now let's see what are the features of a bone. So usually a living bone has got some parts like this. It has got a shaft, two ends. So this is shaft, two ends. This is one end. This is another end. Articular cartilage. So there is a cartilage which is seen here in this area. Periosteum. Periosteum. We will see what is periosteum. Medullary cavity. Endosteum. Bone marrow. So we are going to see all these things in detail. What are these things? Now shaft is also called as body. Now if you consider this as a long bone or a bone, you can see that this area is called the shaft. This is a shaft, the middle part of the bone. This area is the shaft. Shaft is also called as diaphysis. So shaft is a cylindrical long structure, and it has got expanded ends on either side. here as well as here. You can see that here as well as here. In this figure, you can see this is the diaphysis or the shaft. These are the expanded ends. Now here they meet the articular cartilage. So this is an articular cartilage. Here you cannot see the articular cartilage because articular cartilage is not visible in the X-ray. Only the bones are visible. So a cartilage is seen at the articular end. So what do you mean by articular end? It is the area where the bone is going to form a joint. Articular means joints. So where the bone meets a joint, there you have a cartilage over the bone, and that is called as articular cartilage. Here again a joint is formed. So here again you will see articular cartilage. So there is another term which we are going to see, that is metaphysis. So this area is a metaphysis. So this is a expanded end of the bone. So expanded distal end of the shaft where they meet articular ends. So metaphysis is a part of the shaft which is very close to your articular end. So this part is called metaphysis. This part is also called metaphysis. So this is diaphysis. This end is the metaphysis. So somewhere here you'll get metaphysis. Here you'll get metaphysis. This is metaphysis. This area is metaphysis. It is mentioned here. Now, what is epiphysis? The two ends are called epiphysis. So the expanded end are called epiphysis. So they are made of spongy bone, which is covered by a compact bone. So we are going to see some terms here: compact bone and spongy bone. It's very clear from this picture. Here, this area, there are some cavities which are present inside the bone. So where you have cavities inside the bone, this type of bone is called spongy bone. But as you go to the other areas, this area, here there are no cavities. It is very thick, compact. The bone is compact. So this is a compact bone, whereas this area you are going to get a lot of cavities, small cavities inside, and then these bones are called as spongy bones. So why we are talking about this? Because the it is seen in the epiphysis. The spongy bone is seen in the epiphysis, but it is going to get covered by compact bone. On the outer surface, it is going to get covered by compact bone, but actually speaking, the epiphysis is a spongy bone. We can see that here. This is compact bone, which is very thick, but as you go inside this area, it is going to have a spongy bone. So these are epiphysis. Now ends are covered by hyaline cartilage. This area is going to get covered by hyaline cartilage. This area also hyaline cartilage. Here this white colored area is the cartilage. This is the articular end of this bone. This is the articular end of this bone. So they are covered by articular cartilage, or you can say where it is going to form the joint, there it is having articular cartilage. Articular is a term which is used for joint. In this figure, this is epiphysis. This is again the epiphysis, and here there is a cartilage. Here also there is a cartilage, but the cartilage is not seen in the X-ray because cartilage is not radio opaque. Instead you can see a space there. Space is not actually a space here. There is a cartilage which we can see, which we cannot see here, but it is there. And here the articular cartilage are usually hyaline type of cartilage. Cartilages are of many types: elastic cartilage, hyaline cartilage, fibrocartilage. So this cartilage which is there here near the ends of the bone are hyaline variety. Now the ends and the tips of bones which ossify from secondary centers are called epiphysis. Another definition: so the bone which are ossifying from the secondary center. Now there are a lot of terms. Ossification. What is ossification? It is a formation of bone. Ossification is formation of bone. Usually bone is formed from ossification centers. There are two ossification centers: primary ossification center, secondary ossification center. Now, primary ossification center give rise to diaphysis. This is diaphysis or the shaft of the bone. Whereas the secondary ossification center, they are going to give rise to epiphysis here as well as here. So this is another explanation on epiphysis. So epiphysis are part of a bone which is derived from secondary ossification centers. Now there are different types of epiphysis according to the formation or how these epiphyses are going to form. We have some classification. Pressure epiphysis. Now here the epiphysis is formed because of the pressure. Now one more thing you should know regarding the ossification center. I said we have primary ossification center and secondary ossification center. Primary ossification center are usually formed before the birth. Before the birth. Whereas secondary ossification centers are formed after the birth. Or you can say secondary ossification center give rise to some part of the bones, the epiphyseal part of the bones, usually after the birth. So there are some reasons why the secondary centers are going to give rise to epiphysis. So depending on that reason, we can classify the epiphysis into different types. Sometimes you will see the ends of the bonds are formed because of pressure which is applied to it. These type of epiphyses are called as pressure epiphyses. So they are articular, they forms joints and take part in transmission of weight. So here they transmit the weight. They transmit the weight. That is why a pressure is applied to this and this area is developing. This area is also developing. Examples are head of femur, lower end of radius, etc. This is radius bone, lower end of the radius is an example of pressure epiphysis. That means lower end of the radius is developed after the birth due to the pressure which is applied to it. Now coming to the next epiphysis, that is traction epiphysis. As the name suggests, here the epiphysis is formed because of the pull of a muscle or tendon which is attached to that area. So here it can have some attachments. Now look at this bone. This is femur. Example of traction epiphysis is trochanterus of femur. These are trochanterus of femur. So there are some ridge-like structure. Here muscles are attached to this area. That is the reason it is developing a ridge. So initially there was no ridge here, but a muscle was attached to here. But this muscle was pulling constantly. Muscle is acting. So when the muscle is acting, it acts on the or it creates a pull on a bone. So that is the reason it produces a elevation. So this is an example of traction epiphysis. The next one is atavistic epiphysis. Atavistic epiphysis is little different. They are phylogenetically independent bone. They are separate bone in other animals, but in man, it fuses with another bone. For example, this is scapula, and this part of the scapula is called coracoid process. Coracoid process was actually a bone which was a separate bone, but then they fuse with the scapula. So this type of bonds are called atavistic, or this type of epiphysis are called atavistic epiphysis. Again, this structure, this is the talus bone, the posterior tubercle of the talus bone, which was developed separately but later fuses with the talus. So this is an example of atavistic epiphysis. So we have seen three epiphyses: atavistic epiphysis, then the traction epiphysis, and the pressure epiphysis. This is again a pressure epiphysis. Coming to the next term, articular cartilage. We already saw articular cartilage. So these are this one. This is a bone, long bone, where the articular part of the bone. This is one bone, another bone, the other one. Three bones are seen. So at the end, or where it forms a joint, there is a cartilage here. here as well as here, and this is articular cartilage. In this X-ray, this is a joint, knee joint, is formed by some bones, and this area there is articular cartilage. Here there is an articular cartilage, but articular cartilage is not seen in an X-ray. That is why this area looks empty. Here again the same thing. So ends of the long bones are covered by thin layer of hyaline cartilage. You should remember one thing, that it is covered by a cartilage, and that cartilage is hyaline cartilage, and where it forms joints. It helps in absorption of shock during movement. So joint permits a lot of movements. So during this movement, with the shock that is there in the joint, that can be absorbed by the articular cartilage, because the ends of the bone are having articular cartilage. So cartilage structurally it is soft than bone, so it can easily absorb the pressure or the shock. Coming to the other term, periosteum. So this is a long bone. You can see some parts like diaphysis, epiphysis, and this area is a metaphysis. This area is a metaphysis. The inner area of the long bone, there is a cavity, and that cavity is called marrow cavity, or there is a deficiency there inside. There is a hollow area. Now, coming to this term, periosteum. So periosteum is seen on the outer surface of the bone. So outer surface of the bone is this one. This is periosteum. This area is periosteum. Periosteum is covering all the areas of the bone. Here, here, all the areas, excepting an area that is here, where it is covered by articular cartilage. So this area and this area, periosteum is absent. All other place of the bones, the outer aspect of the bone, is covered by periosteum. So periosteum is basically a dense connective tissue. There are two layers of periosteum. This figure is exactly telling the same. This is a section of long bone where this area is the medullary cavity, the inner aspect of the bone, medullary cavity, and this is the outer aspect of the bone. So inner aspect of the bone, I said there is a cavity here. On to the outer aspect, this area is periosteum. So periosteum has two layers, outer layer and an inner layer. Outer layer is fibrous layer. It is made of connective tissue, whereas the inner layer is made of cellular layer. When I say cellular layer, there are osteogenic cells which are placed here. There are four types of cells in the bone, so they can be seen in this area. So this is also called as osteogenic layer. So inner cellular layer, outer fibrous layer of periosteum can be seen in this. Other terms like endosteum, medullary cavity. So when I say periosteum, periosteum is seen outside, endosteum is seen inside. So this area, which is nearer to the medullary cavity, this area you have endosteum. So this area endosteum, and this is periosteum. And medullary cavity is this one. This is a medullary cavity, which is the space within the shaft of a long bone. So this cavity is called medullary cavity or the marrow cavity. I'm sure that you might have seen the bone marrow. So bone marrow, this area, we said that there is a cavity here inside. This cavity is filled with structure that is called bone marrow. So marrow cavity of a newborn is filled with red bone marrow. So newborns, they have a bone marrow which we can call it as red bone marrow, because it is actively participating in formation of blood. So this is red bone marrow. This is mainly seen in the newborn, but definitely it is seen in adult as well. But the amount of red bone marrow which will be more seen in the newborn. But as you become older and older, the red bone marrow slowly changes into yellow bone marrow because of the fat deposition that is happening inside the bone marrow. The red bone marrow becomes yellow bone marrow. So we can see here the red and the yellow bone marrow in this. So this is the shaft of the long bone, and this is the marrow cavity. Inside this you can see bone marrow. Here probably this is an adult long bone. So here red bone marrow is entirely replaced by yellow bone marrow. So bone marrow is going to produce the blood. So I said in the adult, red bone marrow amount is reduced so much in the long bone. But again, adult also needs blood, right? Blood has to be produced in an adult. So where it is produced? It is produced at specific sites at the end of long bone. So there you have red bone marrow in the adult, sternum, ribs, skull bones, and vertebra. Whereas in the newborn, you will see red bone marrow even in the shaft of long bone. Now coming to different types of skeleton. So there are two types of skeleton: axial skeleton and appendicular skeleton. So this is axial skeleton, and this is this red color where it is represented as appendicular skeleton. Axial skeleton, as the name suggests, it is seen at the axis of the body. So this is the axis of the body. So here it is present. So they are closely towards the central axis of the body, like the bones like skull, vertebras are here, sacrum, hyoid bone. Hyoid bone is a bone which is seen in the root of the neck. Sternum. This is sternum. So these are the bones which can be included in axial skeleton. Appendicular skeleton. They are the bones of upper limb and lower limb, which also includes an area here called shoulder girdle, which is close to upper limb, and pelvic girdle, which is close to lower limb. So two types of skeleton: axial skeleton and appendicular skeleton. Totally, we have 206 bones. In that, if we can divide into axial and appendicular skeleton, axial skeleton will have of 80 bones, which includes skull bones. So skull bone is not a single bone. You'll have many bones in that. Altogether, the skull bone has have 22 bones. Vertebrae are 26 in number. Sternum is one. This is vertebra. Hyoid bone. This is hyoid bone. Single one. Ribs. This is the ribs which are seen in the thoracic area. 24 in number, including both side. Auditory ossicles. These are the bones which are seen inside the skull, which are seen in the inner ear. One side you have 3, so altogether 6. So altogether the total number is 80. Coming to appendicular skeleton. Appendicular skeleton includes shoulder girdle, pelvic girdle, upper limb bones, lower limb bones. So shoulder girdles. So what are shoulder girdle? Shoulder girdle, there are two bones for shoulder girdle in one side. They include scapula and clavicle. So one side you have scapula and clavicle. So two are there. So including the other side, altogether 4. Pelvic girdle, they are the hip bones. So this is hip bone. So hip bones are one side. When hip bone is one side, you have one side here, and you have to expect the other side. So right and left side hip bones. So 2. Upper limb bones, all the bones, if you count, it becomes 60 number. Lower limb bones, all the bones, 60 in number. Total number is 126. What are the functions of bone? It forms rigid framework. This we know already. And livers, it forms a livers or serves as a livers for muscles, because muscles are attached to these bones. So it acts as a lever for the muscles to act so that the movement occurs. Now it contains bone marrow, which is a factory of blood cells. So it produces blood. Bone marrow produces blood. which includes all the cells of the blood, red blood cells, white blood cells, platelets, and so on. And the next function is protection. Since it is hard and rigid, so it is going to protect the underlying viscera. Viscera are the internal organs. Coming to classification of the bones. So here I'll just uh, name the bones of upper limb. Only the upper limb I'm going to name. Okay. So shoulder girdle are scapula, clavicle. Then this is humerus, radius, ulna, and the carpal bones here. 8 carpal bones, metacarpals, and the phalanges. Phalanges for the thumb, there are 2 phalanges, but for the other fingers, there are 3 phalanges for each finger. 3 phalanges: proximal, middle, and distal phalanges. Proximal, middle, and distal phalanges. So I just named bones of upper limb. We will name the other bones in the next class. According to size and shape, there's a classification of the skeleton. The next is structural classification. What is the structure of the bone? Developmental classification. According to the development, how it is differing. So the first classification we will see now according to size and shape. So by seeing the shape and the size of it, we are going to classify. So the first bone is long bone. So what is a long bone? This is an example of long bone here. It has got a shaft, 2 expanded ends, and these bones are usually seen in the limbs. So the bones of the limbs are, majority of them are long bones. Now short bones, they are short in structure and cuboid, cuneiform, or trapezoid. The shape of the bones usually are cuboid, cuneiform, or trapezoid in shape, and they can be seen in tarsal and carbal bones. So these are the tarsal bones. There are a lot of 7 tarsal bones can be seen here. So these tarsal bones and the carpal bones, which are seen in the hand, so they are short bones. They are short. Coming to the next, flat bones. Here the bones are very flat, as the name suggests, or like a flat plates. Example, the bones are seen in the vault of the skull. So the outer, the upper aspect of the skull, here these bones are flat bones. Other examples are ribs and sternum. Irregular bones. As the name suggests, they are irregular in shape. There is no particular shape. Example, vertebra. So this is a vertebra which forms the vertebral column along with intervertebral disc. Hip bones, bones of base of the skull. So base of the skull has got some irregular bones, whereas the vault of the skull mainly has flat bones. So this is a flat bone. This is a flat bone. This one. The next one, that is pneumatic bone. So what you can see here is a skull bone. So we have seen that skull bone is not a single bone. It has got a lot of bones inside. So they are articulating together to form a skull. Now pneumatic bones are the bones which can be seen in the skull area. They are having a lot of spaces inside the bones, which are usually air spaces and lined by epithelium. Examples are maxilla sphenoid. So in this figure, what you're seeing here, it looks like a butterfly. So this is a bone of skull, and this bone is called sphenoid. So inside the sphenoid, if you look at carefully, there are spaces, and these spaces are the air spaces. Now, what is the function of this? Why we need to have air spaces inside the bone? The reason is it makes the skull. I said that the pneumatic bonds are usually seen in the skull region or the skull. So this makes the skull lighter in weight. So usually the skull is heavier, right? It's supposed to be heavier, but it is not so heavier because of, or we don't feel that heaviness because of this pneumatic bonds, because they make the bonds little lighter because these cells or these spaces has air inside, and it also helps in resonance of the voice. So the resonance of the voice, that is also depending on the air sinuses which are seen inside the pneumatic bones, because some bones which are near the nose, they have some pneumatic, or they are pneumatic bones, they have air spaces. So this has an important role in the resonance of voice, and also act as air conditioning chambers of inspired air. The inspired air, if it is cold, this maxillary air sinuses can make it warm. So that is another function of it. Coming to the next bond, sesamoid bonds. So remember, we are classifying these bonds according to its size and shape. Sesamoid bonds are like a nodules, and they are embedded in tendons or joint capsules. So they are usually seen in the tendon. So we have seen yesterday the tendon. What is a tendon? What is a muscle? So inside the tendon, you may have some bonds, and they are sesamoid bonds, or they can also be seen in joint capsules. Inside the joint, you can see, or near the joints, you can see. They have no periosteum and ossify after birth. Now here peculiarities are these bones are not having any periosteum, and they ossify after the birth. So ossification occurs after the birth. Examples are patella, pisiform. Patella is the largest sesamoid bone, which is seen in the knee joint. Pisiform bone, this is the patella. This is anterior aspect of the patella. This is posterior aspect of the patella, and this is a pisiform bone. It's a carpal bone which is seen in the hand. Functions are resisting the pressure, minimizing the friction. So it reduces the friction of the tendon because these are seen inside the tendon, and it also alters the direction of pull of muscle. So especially this happens in the patella. The patella, it can alter the pull of the muscle because some muscles are attached to this area at this end, and it can alter the pull of the muscle, or it increases the effectiveness of the muscle. This you can understand when we see the lower limb in a better way. Accessory or supernumerary bonds. So these are accessory bonds or supernumerary bonds, extra bonds you can see. So they are not always present. So it cannot be seen always, or you can say it cannot be seen in all persons. In some persons it may be there, in some other persons it may not be there. They may occur as non-united epiphyses developed from extra-center of ossification. So they develop as an extra-center ossification. It is not a normal ossification center, some extra-center of ossification. Examples are sutural bone. So this is a sutural bone. This is skull bone, where you can see a lot of bones here. They are forming the skull. But see this side, right side. This is a joint which is formed of these two bones. So this is a suture which is seen normally, but on the left hand side there's a suture, but inside the suture there is an extra bone, and this is an example of accessory bonds which are usually not seen. Sutural bone is an example. So the next classification we will see tomorrow according to the structure.